أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. My dear fellows and friends and the students, that I am taking the dermatological manifestation of systemic diseases, which are called the cutaneous lesions associated with systemic illnesses. Or I will say that it is the peripheral stigmata of the systemic disease appearing on the skin and the mucous membranes. I have taken 3 sessions, although the list is not complete. I will say that more than 70% of the systemic disease, they manifest on the skin. In my last 45 years of clinical experience, I have seen many cases, although I was not able to diagnose them properly because dermatology is not my field. But every internist should know the ABC of the dermatology, because these are the important markers actually of the disease, or these are the hard data to diagnose the disease. This is session 4. The nutritional and metabolic disorders, some of them are exemplified here and the others are not. So you can understand the value of the dermatology in the systemic diseases. The iron deficiency disorder or iron deficiency anemia, there will be paleness of the skin, palmar creases and conjunctiva, painful cracks at the corner of the mouth, which is called angular cheilitis, and in the mouth and in the buccal mucosa it is called the stomatitis. Now, shiny smooth tongue, trophic gallositis, means papillae or the lingual papillae are not visible. Spoon-shaped nails, called anachia, and the dry and brittle hair will be seen here. Also, the nails becomes very brittle. Okay. Now, these are the few points which are written here, not all. The Plummer-Vinson syndrome, you know that it is other part of the world. It is called Peterson-Kelly syndrome. This is a unique, finding in cases of the iron deficiency anemia of moderate to severe deficiency is concerned. So, in this case, there is the web formation occurs at the upper part of the varix, and it is a pre-malignant condition. If you will treat the iron deficiency, the condition will be go off. It will be go off, of course. So, these are the examples here. Remember the Plummer-Vinson syndrome. Remember the peripheral stigma. There is a spoon-shaped or the cholinachia. The tongue, they are definitely dry. Of course, absolutely, it is without any papillae, and the patient may see that it is the angular stomatitis or angular cheilitis, and the tongue is definitely very shining tongue. It is. The patient is complaining of the burning sensation in the mouth, and because of the web formation, the person will also, that he will complaining of the dysphagia or odonophagia. I will say odonophagia is the correct terminology, with the painful, swallowing. The vitamin B complex deficiencies, B1, B2, B3, B4, etc., up to the B12. Only few deficiencies regarding complex will be discussed. Vitamin B3, which is niacin deficiency, plagra. Famous for 3Ds, that is dermatitis, diarrhea, and dementia. Although, for 3Ds, it is the plagra. Have you seen any case of the plagra in your life? I have seen cases of the plagra in my life, because I am dealing with the geriatric medicine also. Most of the people I've seen in the Defense Society and the Clifton area. They are more than 75 years of age. It is a sad story, although I've seen the paragraph. The red skin, if it is deficient, what is happening is the red skin with large blabs of blister that exfoliates. Now, erythema over the dorsum of the hands. There will be erythema. It is a, the whole of the hand may be involved. Uniform type of erythema. Scarring over the sun exposed area of the skin. Scarring. Because vitamin B3 niacin is one part, riboflavin, and that is also, and niacin. They are a part which will be definitely included in the amdar marrow pathway or tricarboxylic acid cycle. They are, of course, important one. That's why these regions are seen. Dry, scaly, hyperkeratotic, darkly pigmented skin. Sight mostly over the face, neck, arms, hands, and feet. You find the scaly, hyperkeratotic, darkly pigmented skin, and other findings are in front of you. Like this, the hands are erythematous, they are dry, and they are scarrings. The erythematous patches are seen. On the chest wall, the depigmented areas are seen because they are dark patches. The adjacent parts seem to be depigmented. In the same fashion, the lower limbs, the erythema is there, pigmented. The other part, which is shown to be depigmented. B12 deficiency is a very skin hyperpigmentation. You know that with accentuation of flagell areas, palm, soles, and oral cavity. Cyanocobalamin deficiency. Angular stomatitis, glossitis, and Hunter's glossitis, that is called. That is inflammation of the tongue, and the angular stomatitis means the lateral, both lateral parts of the lips are involved, and it is associated with the xerostomia, and it is a pigment which is xerostom, which is formed in the body because of the deficiency of B12, and associated with vitiligo. Not all cases, but we have seen many cases of vitiligo also. Other than that, there will be definitely ulcerations in the mouth, and the other parts of the oral cavity are affected with the same problem, the glossitis, like the stomatitis, the angular stomatitis, the angular cheilitis, etc. B12 has got other type of the regions. It is very important vitamin deficiency, which you see in our part of the world. Now, it's seen here, this is part, because the vitamin B12 is needed, remember, in the normal deposition of the nerves. So the stimulation to the parts of the hands are not completed, and you find there is a diffuse type of erythematous scaly rash. Tongue is a glossitis, pigmented, hyperpigmented, loss of papillae, again same one. The pigmentation occurs in this area, and the weakness along with this, there is paresthesias, loss of vibration sense, and loss of the touch sensations. Another vitamin is, before going to C deficiency, I'll say that folic acid, which is called terryl glutamic acid, is a common deficiency, and it is associated again with the same type of problems. Skin are dry and scaly, and the stomach, stomatitis occurs in this case. The angular stomatitis occurs. The oral ulcerations can occur with the deficiency of folic acid. Scurvy. Have you seen any case of scurvy in your life? But I have seen many cases of scurvy in my life. I have seen one case. I remember one case when our team of the oceanography and others, scientists, they went to the Antarctica to study something, and the total journey is about 45 or 50 days. They have got refrigeration of the foods, the fresh foods and fresh foods and fruits and other things are not available. Only the part of the beef or the mutton, means that the origin, or any type of the meat can be frozen easily. Other, the vegetables, they are not frozen completely and they have lost the potency. The same as with the other things, that is, fruits are concerned or the pulses are concerned. So scurvy occurs because of the deficiency of vitamin C in those cases which I have seen in my life, that is, they have bleeding gums, they have got all features written here. Perifollicular hemorrhage with the blood pigment discoloration, especially on the trunk and the lower limbs, purpuric rash. Perifollicular hemorrhage. This is the very important point. At the root of the hair, there will be slightly hemorrhage you will see. If it is of a moderate amount of the hemorrhage, then you find the purpuric rash. Otherwise, you have to see and check the root of the hair. Swollen bleeding gums, you see in this condition, and epistaxis may occur sometime because of the fragility of the vessels are affected. Here is the bleeding gums. It is gingivitis. You see the bleeding is there. And this is the diffuse rash, or purpuric rash. If you see in the magnifying power, the perifollicular hemorrhages will be visible. Now, systemic amyloidosis, the myeloma-associated cutaneous amyloidosis, it is the protein which is a degenerated protein which is deposited as the age prolong, and other cases in which there is not relation with the age, but it is the other problem associated, and the chronic type of diseases can be associated with amyloidosis. The myeloma-associated cutaneous amyloidosis, that is called AL amyloid, and then secondary systemic amyloidosis, AA type of protein, and DA amyloidosis, the dialysis-associated amyloidosis. Now, all have got the same type of features, that is, the position of these proteins under the skin, like the myeloma-associated cutaneous amyloidosis, AL type of amyloid. Almost 40% of the patients with the AL amyloidosis have skin manifestations. Lesions tend to aggregate around the mucocutaneous junction, like orbit, lips, and genital skin. And the purpura is also a common finding, which results from the vascular fragility, like vitamin C deficiency, but it is the deposition of the amyloid protein deposition in the blood vessels. You see here, this is shown here on the body, on the trunk, on the lower limbs, and the lower limbs. You see the rash deposition. If you go to the biopsy, you will find the specific staining will reveal the amyloid protein here. Here is the morphological feature just shown here, just like this, under the beard, and where the orbit, upper part of the eyelids, there is deposition of the amyloid under the skin. So skin features are there, but in 40%, 30%, they are important, definitely. Although the disease of amyloidosis is a very important subject, because you have not seen many cases of amyloidosis, the patient, if they exhibit these features, or they have got different type of the dysfunction of the specific organs without any cause, then you have to look after that. It may be amyloidosis, and then the list is not yet completed. I already said that is a long list. I will say if I will discuss this subject, it will take hours. The most important lesions, which are called peripheral stigmata, I have covered in 4 sessions. The people should take interest to learn it or modify it accordingly. I am very thankful to you, because this is he's actually the general medical resident. Now he's a MD specialist in internal medicine. He is a Shanskar Vadoli in the Indore, and he has got much work done. He is an internist, but he's done much work on the peripheral stigma of the systemic diseases, and there is a paper written by him, is a dermatological manifestation of systemic disease. I'm very thankful to him. And then I say thank you to tolerate me for the 4 sessions, because the sessions are very, very prolonged. I'm very sorry that I cannot complete it yet. The list is not completed yet, although the important features have been discussed. So always remember that good listeners are rarely found in these days. If you are a good listener, you are equivalent to me. I am guiding you, but you are most important, respectable personality for me. There is one thing which Allama Iqbal said, that हम तो मायल बकरम हैं, कोई साइल ही नहीं. हम तो मायल बकरम हैं, यानी हम तो काम करना चाहते हैं, सिखाना चाहते हैं, मगर कोई पूछने वाला नहीं है, कोई साइल ही नहीं, कोई पूछने वाला नहीं है, कोई सीखना नहीं चाहता. राह दिखलाएं किसे, मतलब हम उनको गाइडलाइन किस तरह दें कि रह मंजिल नहीं, उनका तो एम ही नहीं है मंजिल पर पहुंचना, तो आप इनको क्या राह दिखाएंगे. दिस इज ए वेरी इंपॉर्टेंट जवाब शिकवा शेर. हम तो मायल बकरम हैं, कोई साइल ही नहीं, राह दिखलाएं किसे, रह मंजिल नहीं. आई एम वेरी सॉरी दैट आई हैव actually uploaded up to 280 videos and let the people, now there are very scanty number of students who have been benefited from our lectures. I think after the death of me, probably somebody will open this channel or will be benefited. I don't know. Or probably some jinnat will be there to benefit from my lecture. I don't know, because I don't know that anybody except one or two students, they have consulted me to हम तो मायल बकरम हैं, कोई साइल नहीं. They were मायल बकरम. So to me is they are मायल बकरम, but actually they have not used their whole energy to learn it. I'm very sorry about it, but nobody in these two years, I have not found any student who want to achieve knowledge from a person who have got more than 45 years clinical experience. Assalamu alaikum wa rahmatullahi wa barakatuh. Wa ma alayna illa al-balagh.